Hi, my name is Lauren Haverkamp, and I am interested in the physical therapy area of kinesiology. And I have applied to Texas A&M in hopes of getting into their kinesiology motor behavior major this next fall semester. So when reflecting upon this assignment, I thought it would be helpful to find an ethical dilemma that's currently facing physical therapy. And I actually came across this dilemma while reading about ethical dilemmas and facing physical therapy in an article. And I thought this one was something that's affecting not only physical therapy, but any medical personnel, doctors, nurses, or anything in the medical industry. So my ethical dilemma is a 75-year-old woman just got out of a double knee replacement, and she does not have insurance, so she used all of her life savings on this surgery, hoping that that would be enough. However, she really needs physical therapy to get her knees and legs working back to how they were before, so that she can have a good rest of her life, so she can actually use her knees for the last section of her life. However, since she has no insurance and the physical therapy is super expensive, she's unable to pay for it. However, the physical therapist knows that she doesn't have insurance and is unable to pay, so he decides to give her a discounted rate and then just pay for the extra off to the side with his own money. And no one will know that he paid for it, and she will just get the care that she needs in order to use her legs again, her knees, and walk around. My first reaction to this was, wow, this physical therapist took charge and he was able to give his patient the care that she needs without her having to take out loans to pay for her medical care. However, when reflecting more upon this, I understand that this is not ethically right at all whatsoever. And since he doesn't decide how much medical care is, so therefore he has no right to give her a discounted rate, even though that would be like the right thing to do. And you have to think about all the other patients that don't have insurance and are unable to pay for their medical care. So if he gave her discounted rate, how is it fair to all the other patients that don't get that discounted rate and are either unable to pay for their care or just take out loans and loans to pay for the things that they need? So this is definitely a really tough situation to handle. However, I think I would handle it. I would try to find a way around the medical guidelines and try to find a way that I could provide her with a packet of exercises that she can follow for a week, and then slowly build her up to 6 months of exercises trying to get her back. However, I am not personally doing it with her. I am just providing her with exercises that she can do on her own. I think that would probably go around the medical guidelines and be a way that she could still work her knees and work her legs and try to get them back to where they were before, and get them functioning without her having to pay a lot of money to get the physical therapy from me. So I think this would be a really tough situation to handle, and I believe that would probably be the best way I would be able to handle it, other than just having to deny her service because she's unable to pay. I would definitely try to find a way to give her the best I could, even though I'm unable to do these exercises with her and walk her through the whole, exercise and treatment. I would really try to find a way around that and try to provide her with anything I could. And that's the way I can handle that. And I definitely think this is a situation I will see as I graduate and go and become a physical therapist and start working. And I think it's going to be a really, really tough situation to handle, and ultimately having to deny someone's service because they just don't have the money to pay for something they truly need. So it's just a really tough situation, but I think it's good to talk about here. So thank you for your time, and that was my ethical dilemma.